This presentation on the 2020 Guidelines and Updates for ICD-10-CM was created by students at Cuyahoga Community College as part of a group project. This section will cover the chapter-specific guidelines for chapters 4 and 6. Please see our other videos for further chapter-specific guidelines and also for the general guidelines and updates. Chapter 4. Endocrine, Nutritional, and Metabolic Diseases. Codes from this section will begin with E00 through E89. Majority of the codes in this chapter deal with diabetes. Diabetes mellitus can be a very complicated condition. There are many combination codes in this chapter that include the type of diabetes, the body system affected, and the complications affecting that body system. As many codes within a particular category as are necessary to describe all complications of the disease may be used at one time. If the type of diabetes is not documented, we default to type 2 diabetes, code E11. When insulin use is documented, then we use a code from Z79, which indicates long-term or current use of insulin. Secondary diabetes is always caused by another condition or event. It is coded as follows: E08 for diabetes due to an underlying condition, E09 for drug or chemical-induced diabetes, and E13 for other specific diabetes. Underdosing or overdosing of insulin due to insulin pump malfunctions needs to be coded. If an insulin pump failure results in underdosing, the principal diagnosis, T85.6 for mechanical complications, would be coded as the principal diagnosis. The secondary diagnosis would be for the underdosing of insulin, T38.3x6. You would also need to include any additional codes for the diabetes type and any complications which are due to the underdosing of insulin. If the insulin pump failure results in overdosing of insulin, the same principal diagnosis for mechanical complications is used, T85.6, but the secondary would be for poisoning by insulin accidental, T38.3x1, and make sure to include the code for the type of diabetes. Chapter 5. Mental, Behavioral, and Neurodevelopmental Disorders. Codes from this chapter all begin with the letter F. Psychoactive substance abuse, use, and dependence. You would only code either abuse or use or dependence one at a time. If documentation is unclear, the provider references multiple terms in the chart, such as if they use both abuse and abuse, then you code to the highest one in the hierarchy. So if use and abuse are documented, you would code abuse. If use and dependence are documented, you would code dependence. If all three are documented, you code dependence. If the provider documents that the case is in remission, you may code that, but only if it is specifically documented. Chapter 6. Diseases of the nervous system. These codes begin with the letter G. Codes from category G81 for hemiplegia or hemiparesis, and some of their subcategories, have indications in the code for whether the side affected is the dominant or the non-dominant side. When coding for this, if the dominant side is not documented, we default to the right side being dominant. Likewise, if the patient is documented as being ambidextrous, we still default to the right side being dominant. Category G89, pain. Code G89 is for pain not elsewhere classified. We do not use a code from this category if the pain is not specified as being acute, chronic, post-procedural, or neoplasm related. It must be specified if you're going to use a code from G89. We also do not use G89 if the underlying condition is known. Unless the encounter is only for pain management, then you can use G89. G89 can be used as a principal diagnosis if pain control is the reason for the encounter, but you will need to list the underlying cause of the pain as the secondary diagnosis. G89 can also be used in conjunction with codes that identify the site of the pain if G89 will provide additional information. So as we mentioned on the previous slide, a code from G89 may be used as a principal diagnosis if the reason for admission is pain control or pain management. Code G89.2 for chronic pain is used when the provider documents the pain as chronic. Code G89.3 for neoplasm-related pain may be used as a principal if the reason for encounter is pain control or pain management. Be sure to list the underlying neoplasm as an additional diagnosis. The codes for central pain syndrome, G89.0, and chronic pain syndrome, G89.4, can only be coded if the provider explicitly states either of these in the chart. Here's a question. A patient is admitted for chronic pain in their left shoulder. Which is the correct sequence of codes? Option 1, pain of the left shoulder as the primary. The secondary code of G89.29 for other chronic pain. Or option 2, primary code of G89.4 for chronic pain syndrome, the secondary code for the pain of the left shoulder. The answer is option 1. Pain of the left shoulder is coded as the primary. The G89 code for other chronic pain is listed as the secondary because it provides more detail about the pain of the left shoulder, indicating that it is chronic. As for option 2, we did not choose that because chronic pain syndrome was not explicitly listed in the information that we were provided. Thank you for listening. Please see the links in the description section for links to our other presentations.